Yes, folks, it's time for the Millennial Conservative Resistance to continue. I'm your host, Andrew Coppins, and this show is Critical Thinking, airing every Saturday at 5 p.m. Central Time on Mojo 50 Radio, and of course the Mojo 50 Radio Facebook page. Thank you to all of you that are listening and watching live, and if you're not, well, we're still in lockdown for the vast majority of this country. What better thing do you have going on in your life at 5 p.m. on a Saturday where there's no sports, there's literally no entertainment? I hope I can provide you some entertainment and some information here on this show. Of course, coronavirus. Luckily for you, in the first half of the show, it'll be anything but coronavirus as we welcome in Bryce Hill of Illinois Policy to talk population, its decline here in the state, and what it means. And then in the second half of the show, we will pull the lever. We will talk coronavirus, but we're going to do it in a way that nobody else is doing. And that means we've got to bring on Chris Jacobs, the author of The Case Against Single Payer. That's right, folks. Chris Jacobs joins us to talk about policy, prescriptions, and healthcare in the second half of the show. Of course, you can follow me on the socials at The Coppins Show. That's Facebook, Twitter, Instagram, Parlay. Definitely Twitter, definitely Facebook. That's where you can interact with this show more often than not. Now, most importantly, though, folks, we have the YouTube page. You just simply search Andrew Coppins on YouTube. Simply search Critical Thinking on YouTube. You will find the show. Thank you to all of you that have subscribed over the past week. I really, really appreciate it. And the reason why I'm highlighting this is that while this is the weekend show, you can find me every Tuesday and Thursday talking all things numbers, politics, data, and of course, the news of the day over on the YouTube page. 10 minutes or less usually. And I hope that it provides a bridge for this show each and every week. So go check it out, because this week I did an absolute dive into the dumpster fire that is the data around the deaths within coronavirus. And then on Thursday, of course, we got attacked. Those of us who dared to question the data and the data sets and the modeling and all of those sorts of things are just know-nothing conservatives, according to the fine folks over at the Bulwark. So please check that out. But with all of that out of the way, before we get into our conversation with Bryce Hill, I wanted to talk about something that just got swept under the rug this week, and that is that Bernie Sanders is out. Yes, the venerable curmudgeon of socialism is no longer in the race, and that means socialism has died for the 2020 election cycle, at least in terms of a fervent person pushing it. And we'll talk about Joe Biden and his policies later. And by later, I mean potentially on the YouTube channel or a different episode of this show. But I thought I wanted to talk about Bernie Sanders. And then I saw the 538 piece on why Bernie lost. And, well, they gave 3 reasons. One was that Sanders decided to court the white, non-college educated, blue-collar workers as his go-to ticket along with the youth vote, which is basically what he did in 2016 to win a state like Michigan, to win and really push Hillary Clinton to the brink of, having to rig the entire nomination process with superdelegates and the like. So I found that to be very interesting, and I think it's true here, because if you fast forward to March 10th and that Michigan primary, right, that was the primary that Bernie Sanders kind of planted his flag as his last stand. And he got trounced by Biden. Biden just ripped him apart. But when you break down the demographics, he ripped him apart in the white, non-college educated, blue-collar worker demographic. That's a problem if you want to win an election, and that is your go-to meal ticket. Clearly, that was a problem. And yes, folks, by the way, electoral politics really is, guess what, about, wait for it, demographics. It's about courting specific people. It's about making sure that, maybe the policy prescription that you have for XYZ makes sense for the African-American community more than it would for the white suburban community. So you go to them with that policy. You go and market yourself in certain ways to certain people. It's just how elections are won. It's always how elections have been won. That is the reality of elections. And then secondly, what 538 said is that Sanders is who he is. That's to say, a socialist. And his miscalculation was that, again, this was 2016 all over. And it couldn't possibly be that, because why? What you had here was not a reset election. What we have here is a referendum on Donald Trump, and the Democrats want Trump out of office at all costs. This is not an ideological battle. This is not we now are done with a two-term president. Where do we go as a party type of a battle? That is what Bernie Sanders was counting on happening here, and it never materialized. Instead, even the people that were more socialist in nature, like Kamala Harris, like Elizabeth Warren, like Pete Buttigieg and Beto O'Rourke, all of them surged in their popularity when ideological battles were happening. And then when it became, well, do we really want to vote for those individuals and then have them go up against Donald Trump in the general election? Yeah, not so much. And that's really what was at play here. Now, the third thing that I wanted to highlight is what they said in that 538 article that I believe to be untrue, which is that socialism is not in vogue in the Democratic Party. It very much is. When you take a look at the willingness of people to vote for candidates that are socialist, it's very clear that it is on the rise. You've got socialists like Ayanna Pressley, Ilhan Omar, Rashida Tlaib, AOC, and on and on and on, getting elected to national offices on a platform of literally being a member of the Democratic Socialists of America. So socialism's on the rise, but when you mix that with electability, that's where you got Sanders' problem from. So congratulations, Bernie Sanders. You are now done and dusted. It is time for you to pass the torch. Boy, oh boy, is that going to be fun. But let's go ahead and move on here. And before we do so, folks, you've got to check out our fine friends at American Pride Roasters, AmericanPrideRoasters.com. I had a chance to taste the Burr Hamilton coffee for the first time this week. And folks, if you have not done it, it is a game changer. Go over to AmericanPrideRoasters.com, get yourself a 1-pound bag of the amazing Burr Hamilton. Smells like blueberries and donuts. Oh, it is just delicious and divine. Head over to American Pride Roasters. Tell them Mojo50 sent you. And DM, X and DM, I'm looking at you. All right. That means it's time to head into our talk with Bryce Hill of Illinois Policy and the population conundrum that the state faces. And continuing with the theme of non-coronavirus talk in the first half of this show, I'm joined today by Bryce Hill, a research analyst, aka a man after my own heart, but a research analyst over at Illinois Policy as we get our monthly dose of all politics being local. This is Bryce's first time on the show, so first off, welcome into Critical Thinking and thanks for joining me here. How can people follow you?
Sure. So first of all, thank you so much for having me. You can check out all my work at illinoispolicy.org. Follow me on Twitter, and we'll post all of our stuff on there as well at Bryce T. Hill.
All right. So whatever shall we talk about if we're not talking coronavirus? I know that's like the only topic anybody in any sort of sphere is talking about here. But how about we just switch to, I don't know, an equally depressing topic for the state of Illinois, declining population. So first, can you set the stage for our listeners who may not be from the state of Illinois as to what has actually happened in terms of declining population and as we look at the last decade that has gone on?
Absolutely. So just shortly before all of this coronavirus pandemic really made its way to the forefront of every news storyline, we got some U.S. Census Bureau data that posed some really negative statistics for the state of Illinois. So just for a little bit of context, over the past decade, so since 2010, Illinois has suffered the worst population decline in the nation in terms of the raw numeric and decline of citizens, and then the second worst in terms of as a percentage of the state's population. So it's not just like, Illinoisans are it's a natural thing, the aging of a population or anything like that. It's actually almost entirely due to Illinoisans choosing other states to move to, and fewer people moving in and more people moving out. And then, as I mentioned, this new data that we got at the end of March showed that for only the second time on record, every single metropolitan area in the state experienced population decline. That's never happened before, with the exception of 2018. So since 2017, every single metro area has been shrinking population due to the same reason why the state overall has a shrinking population. People choosing other states over Illinois.
And I think the key here is that, the state has 10 metropolitan areas. It's not just Chicago. And for the listeners that are outside of the state, I'm sure that they think of Illinois, they think Chicago and Chicago only. It's definitely a problem, but what I think the analysis and what the numbers are telling us, and correct me if I'm wrong here, but the numbers seem to tell us that it's not just a Chicago problem. It's telling us that no matter where you are in the state, whether that's in, Carbondale or Champaign or out west in the state, there are issues that are making people flee the state in record numbers.
Yeah, I would actually say that it might be a worse problem for Illinoisans to find themselves outside of Chicago. So we are seeing the largest declines in areas like Danville, Decatur, Peoria. Those are the areas that are being hit hardest from population decline. On a percentage basis, obviously, the large population in Chicago means that most of the people who are leaving the state, it appears, are leaving from Chicago, but that's just purely a factor of the large population. Although we should note that Cook County experienced the second largest population decline in the nation, both in the past year and since 2010, and was second to only Wayne County, Michigan, for population decline in the decade, which is the county that houses Detroit, which was particularly hard hit over the past 10 years, especially during the recession.
Yeah, no doubt. And I think, that should put some perspective into the numbers here for people that are listening. Again, we're speaking with Bryce Hill of Illinois Policy at Bryce T. Hill on Twitter if you want to follow along. But much like you, obviously the raw numbers are startling. But, one of the questions that I have here is this a case of states outside of Illinois just being so much more attractive? Or is it that Illinois has been doing it way wrong and people are just really sick and tired of dealing with this year and year and year and have just decided to get out?
I would say that it's largely an Illinois problem. So our neighboring states aren't experiencing population decline. States like Indiana are actually attracting people from other states, so they're seeing positive net migration. So I definitely would say that the state population decline is Illinois specific, and that it is directly a result of poor choices in public policy and the realities that it's meant for families and businesses trying to make it in the state, and it's becoming harder and harder to do so.
And one of the other questions for me here is, as you mentioned, if you look at it like on a per capita basis, you're seeing other areas outside of Chicago being much more affected. Do you think that a lot of this is coming from the seeming, bailout after bailout for the city of Chicago and the inability to, and thusly, I should say, the need of all of those other areas to pick up the slack, if you will?
I would say that there are a few things at play here. So one, we have this larger trend that's really a national trend of urbanization. So Americans have, in recent years, been fleeing to more densely populated areas. But then we have another issue of I'm not necessarily sure how much the bailout of Chicago, as you put it, is having an effect. But the people living in other downstate parts of the state aren't seeing as many benefits for their dollar coming to their areas, which I think is kind of what you're getting at. So,
right.
People that are there are, they're paying the same taxes, they're paying property taxes that are amongst the highest in the nation, and especially for people who are on a border. So when you look at places like, if you're living in Rockford, Illinois, or even in the Chicago area or Kankakee, really moving to a different state doesn't involve uprooting your life. And so that's probably the reason why, you're seeing maybe some larger population changes in those areas, as people can keep their same job if they want to. They could keep, they're not cutting any family ties. They could still be basically in the same exact area, and now they're just living on a different side of the state line. So that makes the public policy aspect of it extremely important for these border communities.
Yeah, and I think that is where I was wanting to go next. So you just teed it up for me, because I'm all about solutions, not just knowing the problems. It's great if you understand it, but what are you going to do about it, right? So what are some of the things that Illinois policy sees and that you see that the state government could do to stop this leak of citizens? Because for me, if it doesn't that just mean that things are going to get more burdensome for those of us that are still here?
You're absolutely right. So I think, by and large, what we need to do to keep people in the state and to actually attract people to move here, are to provide opportunities. It's the number one people say they've left for. When the Census Bureau looks at reasons why people have left the state of Illinois, the number one answer is a labor market decision, meaning they have found a job opportunity or moved for a job opportunity that they didn't have here. And the second being the housing market. So this kind of gets back to the larger point, is that the tax environment, it's made it unfriendly for individuals who are looking to purchase homes and start a family. They're facing sky high property taxes, the second highest in the nation. And then for businesses, somebody looking to invest in a business, or it has spillover effects for employees, people who are looking to get hired or looking for job opportunities. Constant tax hikes, and now the threat of a progressive income tax hike have really made it hard for businesses and families to have confidence in the future in Illinois. And I think that that's really highlighted in what's going on in the Chicago area. So we mentioned Cook County lost the second most people in the nation. They lost over 45,000 people. But an interesting part of this is that at the beginning of the decade, the counties surrounding Chicago, the collar counties, were actually seeing the strongest population growth of counties in Illinois. And then by the end of the decade, that had kind of fizzled out. And now most of the collar counties and counties in the extended area around Chicago are actually seeing population decline now. So, where people used to be moving to the suburbs so they could be close to Chicago for a job opportunity, or maybe moving out of Chicago to start a family in the suburbs, it's increasingly not the case. So I think that really illustrates just what is happening in the state.
Yeah, and I think what you're seeing is a very large problem that I think can only really be solved by, government looking at itself and saying, what are we doing that's making this problem worse, and how can we make it better? And it'll be interesting to see how this happens. But I promised this was going to be coronavirus-free half of the show here on Critical Thinking, but I do have one sort of related question here, because, as we sort through the rest of this issue and kind of hit the reset button, if you will, both as a city and a state, I feel like now more than ever, we do have a population that may fully understand the significance of the course that the state has been on for well over a decade. So do you believe that this would actually present an opportunity for the reforms that we have talked about and that Illinois policy advocates for to actually get enacted? I personally think that you're going to see the progressive income tax be taken completely off the ballot in November. I don't see how that is something that would behoove J.B. Pritzker and Madigan and the bunch down there in Springfield.
I agree with you that this ordeal is going to present some really once-in-a-lifetime opportunities to get real reform passed in the state. I'm not so sure whether or not the progressive income tax will get taken off the ballot. I would hope so, and if it does stay on, I hope, I'm pretty confident in everyday Illinoisans' ability to see through what the progressive tax amendment actually is, and it's just a call for higher taxes. And especially given the circumstances surrounding the economy right now, it would probably make it very difficult for that measure to pass. So So I am very confident that we're not going to have a progressive income tax. I am also confident that we're going to see real discussions of reforms happening around this, because the economic fallout of the current pandemic and the budgetary implications of that are going to be massive. And there are really only a few areas that you can look to make changes to really free up space in the budget, so that you make sure you're spending on social services that Illinoisans are relying on, and you're not, so to speak, wasting your money on unnecessary items. And I think the largest chunk that we're going to find is the 25% of the state budget that's going to current pension obligations, which continue to deteriorate. So I think we're going to see, we're going to see a lot of opportunities for reform. Once we get a final number on how big the budget hole actually becomes, we're going to realize that the $3 billion, which is probably inaccurate now because of the economic crisis we're going through. The additional dollars from a progressive income tax are really just going to look like a drop in the bucket compared to the massive pension obligations the state has, which Moody's currently puts at over $250 billion. So I think we're going to see that rather quickly, that really the only way to move forward with the state and to gain the trust of taxpayers is you're going to have to start looking at things like constitutional pension reform, because asking taxpayers for more money, especially when it's such a paltry amount compared to the size of your bills, not that the tax hike isn't massive, it is, but it's such a paltry amount compared to the size of the bills that are coming due because of it. It's going to be obvious, hopefully, to people that this isn't the solution to the problem.
Yeah, and I encourage everybody, if you have an opportunity, check out IllinoisPolicy.org. Get involved if you live here in the state. If you live in Chicago, please get involved, because as we move towards that November election, and I think this is a critical moment for us to be able to really be active and to really finally demand the changes that need to happen in order for us to save ourselves from ourselves, if you will. But, Bryce, one, how can people follow you? And two, what are some of the ways that Illinois Policy encourages activism here within the state?
Sure. So IllinoisPolicy.org is the place to stay up to date on everything that we're working on. There's new content on there on a daily basis. So there's all sorts of wonderful, relevant research at the state and local level for people to read. You can also follow myself on Twitter at Bryce Hill. But also, I would say the biggest tool maybe for the average Illinoisan that we present is we have a Facebook group called the Lincoln Lobby, and it's a group of nearly 20,000 Illinoisans who are like-minded, focused on state and local issues that are affecting their lives in the ways that we're talking about here today. And we actually keep them up to date with what's going on in the State House, because we have a government affairs team, and we have a legislative agenda with bills with bipartisan support that we are actively seeking to get passed through the General Assembly. We also alert them to anytime they can take action for upcoming legislation, whether that be signing a petition to lawmakers or to file a witness slip, which are really important when it comes down to lawmakers making votes on bills, because the witness slips are typically read at every single bill hearing, especially for more contentious topics. So we provide a megaphone basically for the everyday taxpayer, since there aren't very many people lobbying in Springfield on their behalf. So that would be what I would say is the number one way that Illinoisans looking to make a difference and looking to get involved should get in contact with us.
All right. Well, thank you so much for your time this week. We hope to have you back soon. And as we talk about a legislative path forward that hopefully tackles all of this. But thank you so much for joining us this week.
Thank you so much for having me.
And again, thank you to Bryce Hill for joining us. We will be back in just a few moments right here on Mojo50 and Mojo50.com. And of course, follow me on Twitter at The Coppins Show. Welcome back into Critical Thinking. Yes, of course, it is I, Andrew Coppins, at The Coppins Show. Twitter, Facebook, Instagram, Parlay, whatever your pleasure is, I am there in terms of social media. And folks, we talked anything but coronavirus in the first half. We got to talk about coronavirus here in the second half of the show. And to do that, I have the author of this very fine book, The Case Against Single Payer. Check it out. Again, that's The Case Against Single Payer. And here's my conversation with Chris Jacobs. Folks, when I want public policy ideas around healthcare in America, I go to Chris Jacobs, author of The Case Against Single Payer, a senior contributor at the Federalist, CEO of the Juniper Research Group, and a man of oh so many talents that I can't list them all here. Thank you for being here on Critical Thinking. I just wish it weren't in the middle of this type of a pandemic situation.
I hear that, but thanks very much for having me again.
Yeah, of course. And over the past month, we've seen, not just real panic, but political opportunism of the highest order. That has included, people like AOC, Rashida Tlaib, and all of those types of individuals pushing all sorts of socialism down our throats. So, Chris, my first question, as you look backwards at what has happened already, what's been the most alarming thing to you from a public policy perspective?
Well, I do think it's the Rahm Emanuel quote of "Never let a crisis go to waste," and I believe Jim Clyburn said the same thing. Well, this is an opportunity to get much of our agenda enacted. And so you've seen kind of these moves by folks on the left to enact a big government agenda. And I think it's ironic that folks on the left, on the one hand, are saying that the government is incompetent and Trump has messed up the response to coronavirus and all that sort of thing. And on the other hand, they're saying the solution to it is more government.
Yeah, I've never gotten that. But one of the things, speaking of government here and the response to the coronavirus, is a piece that you just did over at the Federalist, talking about one of the strangest things that has come from this response: blocking further fighting of Medicaid fraud and abuse. Now, could you explain what is actually happening and why that fight wouldn't want to happen right now, especially considering, I don't know, saving money in these economical times, probably a good thing?
Sure. Yeah. It would be a good thing. Saving money, what's that all about? We don't have any of that in Washington.
Right.
The stimulus included assistance, bailout, you can call it whatever you like, for state Medicaid programs. This is the second stimulus bill. This is the $100-some-odd billion bill. Mm-hmm. And it included a 6.2% increase in the Medicaid match rate for states. In exchange for that, however, they could not essentially make any changes to their programs. These are called maintenance of effort requirements, is the technical term. There were maintenance of effort requirements included in the 2009, the Obama stimulus bill, and in 2010, as part of Obamacare, there were further maintenance of effort requirements. The principle makes sense in the sense of the feds are giving people more money, so the states shouldn't claw that back to use on other things. But the problem is it blocks any changes to the benefit methodology or any really reforms to the Medicaid program. You can't increase premium. You can't impose a premium even as small as $1 a month. And you can't take other steps to reform your Medicaid program. Andrew Cuomo, as I outlined in the article in the Federalist, New York's Medicaid program has had issues with fraud and abuse for years. It's one of the reasons that the state had a $6 billion budget deficit before coronavirus even happened. They had a massive budget deficit in large part due to Medicaid. And he has promoted a Medicaid reform proposal that would make some reforms to Medicaid. And they tried, Cuomo and with Republicans tried to get language in the third stimulus bill, in the $2 trillion stimulus bill, to undo some of the harmful effects of the second stimulus bill when it comes to allow New York to enact its reforms. And somebody on the Democratic side, quite possibly Chuck Schumer, blocked that. And so it was not enacted into law. And so Andrew Cuomo cannot include any reforms to fight fraud or waste in the Medicaid program, nor can any other state.
So my fellow critical thinkers out there, this is what you're dealing with. You're dealing with not just, fighting Democrat, Republican. It's statist versus statist. It's absolutely incredible to see that level of dysfunction within our government. You can't even possibly fight waste, fraud, abuse, whatever you want to call it, within this program to save the program. I don't understand it. But one of the things here on this show this week, Chris, is my theme of let's look forward. Let's, talk about a path forward in lessons that we have learned and how do we move forward. To me, the lesson here during this entire coronavirus panic situation has to be that the government has gotten out of the way. The private sector has really kind of filled the needed voids. Things like quicker testing results, vaccine trialing, ventilator production, all of those things. It seems to be the lesson is government gets in the way of fixing issues. Is that what you're seeing here?
Well, certainly we've seen some of that with the response. I think particularly the testing issue. And one of the reasons we still have a testing backlog is, first of all, the CDC's initial test didn't work. And they had to redo the test and reformulate the test to make it work. But at the same time they were doing that, the CDC and the FDA were also blocking the private sector and other labs from manufacturing their own tests because this was a public health emergency. And so for the entire month of February, the testing situation was bogged down. That the public sector was doing the wrong thing in terms of CDC had problems with their initial test. And then at the same time, they were prohibiting, I believe it was February 29th, when they finally gave private sector labs the ability to develop their own tests and say, okay, you can put these into the field and then come back and validate them within a certain length of time. So it was a case where the government was, number one, doing the wrong thing, number two, holding up the private sector entities that were trying to do the right thing. And we could have been a lot further along if private sector entities had the entire month of February to develop tests on their own.
Yeah, and I think that's the prime example of, the government knows it all, right? The government needs to control it all, and it turns out that the broader that you get with this, the more information we get, the better informed we can be about making our decisions. I think it's absolutely incredible that we've seen those simple regulations go by the wayside, and the results have been dramatically and quickly different. So I think that is a lesson that everybody needs to take away from this, is that the private sector comes in, cleans up the mess, and we get better results. They're not perfect by any means, but one of the other things here for me is constantly being a watchdog, because like you said, no crisis go to waste, and all the things that Ezekiel Emanuel is famous for saying here. But when you look at the socialist lurch in the Democratic Party here, we're talking about our fourth potential stimulus bill. What are you seeing on the healthcare side in terms of the potential to lurch towards, single payer or those types of things? Are we seeing more momentum, or are we seeing this maybe being baked into some of these bills that we might not be able to back out of?
Well, I think, frankly, you're seeing one of the reasons, a good argument, at least from my perspective, against single payer and against even a quote public option, a government-run health plan. Hospitals right now are facing a lot of turmoil and a lot of financial difficulty. Some of that, of course, is the added costs of treating patients, that they're having to come up with triage tents, they're having to expand their bed capacity, they're having to buy more protective equipment for their doctors and their workers. But a lot of hospitals' problem is coming from the fact that they're canceling elective surgeries. And the technical term is the case mix.
Hmm.
that hospitals are canceling elective surgeries, and those elective surgeries are being replaced with coronavirus.
Right, and
Problem is,
that creates a massive financial problem for sure.
correct, that you have a massive shift in like I said, in their case mix, that they're replacing higher paying elective procedures with lower paying coronavirus procedures. Well, that's exactly the kind of dynamic you would see in a government run health plan or under single payer. You would replace high paying people with private insurance with lower paying government run insurance plans. And what are the problems? Hospitals and particularly hospitals and medical practices are having to lay off staff, furlough staff, cut pay, cut at the time when they should be incentivizing people to go into these very stressful situations. They're having to do all of that because of the financial dynamic at play, losing those higher paying cases. That's
Right.
exactly what you would see. It's a precursor to what you would see under government run healthcare.
Yeah, and I think it's important that everybody hears that message. What we are seeing is a rationing of care, and it's because and I understand part of why it's happening, right? Because you want to be able to take care of something in a pandemic situation in a different way than you would in a normal hospital situation. When you talk about the flu, when you talk about all of those things, the epidemic levels of them can be handled while still doing elective surgeries, while still doing all of those things. But we're also hearing, cardiologists and people here in Chicago, doctors are saying they're having to lay off their nursing staffs. They're having to lay off, all sorts of people, because even people who have heart attacks or having strokes, the rate of these things are going dramatically down. And it's not about the profit motive; it's about supply and demand. When you've got no supply or no demand for your services, you have to shutter your doors. And is exactly what's going to happen on a much larger and broader scale when you implement a public health system like single payer healthcare. Am I right in that dynamic?
Sure. So there are kind of two separate dynamics. One is that non-essential medical providers, for instance, my dentist, I was supposed to have a dental cleaning 2 weeks ago. They've shut their office. They said we're not essential. We're doing emergencies only. Those sorts of things. So their revenue has been shuttered, like the restaurants and the hotels. The people aren't flying. People aren't traveling. People aren't going to restaurants. They're kind of a lot of the physician offices are facing the same sorts of problems that ordinary mom and pop businesses are facing, restaurants and so forth.
Mm-hmm.
Then the hospitals are facing a different problem because they're getting a lot of patients. They're just a different type of patient.
Mm-hmm.
And so there are more coronavirus patients, or there are less elective surgery patients. So there's kind of two different problems. Certainly the hospitals, how their financial case mix has changed dramatically in the space of a few weeks. That's what's causing them all the heartache and the financial stress. And I think that's a precursor of what you would see under single payer.
Okay, that makes sense here. So one last question on coronavirus, and then I promise we're going to go somewhere else for a little bit here, because one of the themes on this show is talking about anything other than coronavirus. But the $1 million question, because it's super easy to play critic, right? It's super easy to pick apart the public policy prescriptions or whatever. But it's actually much more difficult to come up with a plan, and that's why I love what you have done with your book. Again, that's The Case Against Single Payer. Buy it on Amazon. This is a great time to read this book. It gives you knowledge, but it also gives you plans forward. So if you had your way, how do we get the healthcare system to give us better results in times of crisis and pandemic or epidemic? Because one of the things, Chris, that a lot of people have not paid attention to is that prior to the pandemic of coronavirus, we had 10 weeks of epidemic levels of the flu or pneumonia, which some people say might have actually been coronavirus. We just weren't testing for it. But regardless of that, we were seeing very high emergency room rates, very high hospitalization rates and mortality rates with the flu and all of those things. So when we see those types of crises, how do we get the healthcare system to give us better results?
Sure. I would preface this by saying I'm not an epidemiologist. I'm not a physician. I'm a policy analyst. So
right, from a policy perspective,
the technical details of how to reopen the country in respect to the coronavirus, I'm going to let people. I think
absolutely. I'm just talking from a public policy perspective here, because I think it's important to have that in place in order to allow those other things to go the way they need to go.
I think just broadly, I think a lot of this goes back to primary care and having good quality primary care to handle some of these issues. Certainly something like a direct primary care is able to handle normal outbreaks of the flu, that people have a regular source of trusted source of medical information and a trusted primary care doctor to take care of them. Obviously, this is a different situation if you think you have coronavirus because it is so infectious. A lot of primary care doctors are sending people to hospitals or telling people to shelter in place when they have symptoms. But I think broadly, certainly the idea of improving the focus on primary care that's more patient-centered would be a step in the right direction, and one way that we need to improve our healthcare system and reorient our healthcare system.
And when you're talking patient-centric, can you expound upon that and what you mean from a public policy perspective when it comes to that? Because what I take away from this is very simply that, we have a healthcare, whether we're talking insurance or delivery system, that is focused on specialization, that is focused on getting people into or away from primary care into much more expensive areas all the way around.
Yeah, I think patient-centered means it's responsive to your interests. Some of that involves letting people know, hey, what does this cost? And some of it, at least when it comes to routine care, of patients having an incentive to find out what it costs.
Yeah.
Certainly find information about quality. Find out, in a lot of cases, people can't find out whether their doctors, which doctors are in their physician network for their insurance. Something that simple of insurance companies putting out accurate provider directories is something that's very difficult. So just making it more responsive to patients. Right now, it's generally responsive to insurance companies or to employers who control the dollar signs. In theory, the patient should be controlling more of the dollar signs, and the system needs to respond to what the patient wants and what's in the best interest of the patient, not what's in the best interest of the insurance company or the employer.
Yeah, I think I always use this example for people who are questioning, well, why does price matter? Ask your primary care physician or ask the knee specialist that you're seeing, what is their cost for an MRI? Then go to an MRI center and they'll tell you up front, this is what this costs. I guarantee you, you'll see the MRI center have an actual cost structure where you can negotiate payment, you can negotiate all of those things, and not necessarily that you're going to negotiate the final price, but you may be able to negotiate, hey, I can't pay that up front. Can we spread this out over 12 months or 24 months or whatever have you? You cannot do that with the system that is set up the way that it's set up through hospitals and in the physician system that's currently in place.
Right. And I think it's making it more, there's tremendous variation, even for something that, even for services that are essentially commodities, like MRIs being one, or lab testing, blood work kind of thing. There's tremendous variation in prices. And even for those shoppable medical services, especially for those kind of services, you start getting competition, all of a sudden those prices come down. And once you make things transparent, that people can choose and they have incentives to choose, that's the way you start bringing prices down.
Yeah, absolutely. I think it's everybody working and pulling in the same direction when it comes to that would matter here. But before we go, Chris, again, we're speaking with Chris Jacobs, the author of The Case Against Single Payer. Buy the book on Amazon. It's a really fast read. It's really packed full of information, but it's done so in a very easy to digest way. So I really highly recommend it. But before we go, I have to ask you about something that's non-coronavirus related, since, that was the theme of the show today. But you also wrote a recent piece in the Federalist about Joe Biden's plan for healthcare. And if I was reading the piece correctly, it seems to me that there are aspects of his plan that are actually more controlling or worse than the, socialism that Bernie Sanders was proposing through his Medicare for All. Could you walk us through what you mean by that?
Yeah, so I wrote an article about the quote public option as it's being rolled out in Colorado.
Okay.
Colorado, just prior to the coronavirus outbreak, lawmakers in Colorado released their bill for a quote public option. It really isn't an option, though. It is requiring hospitals to participate, and it is requiring insurers to participate, or otherwise the hospital could have its license taken away by the state. So you think about that. You have to serve these people, or else we're going to put you out of business. And of course, it doesn't guarantee that the rates they set for this public option will necessarily be sufficient to meet a hospital's cost structure. So they could be literally forcing a hospital to treat patients at a loss, or we're going to revoke your license and shut you out of business. I think that raises huge issues. There's been some move, I think Massachusetts several years ago tried to tie physicians' acceptance of government-run plans to their medical licenses. And I think that raises huge constitutional issues. The fact that you remember, Obamacare required everybody to buy health insurance for the first time ever. This is requiring hospitals to treat patients, or we have the potential we will fine you, but we could also revoke your license to operate businesses. That's just a vast increase in the government's power. At least Bernie Sanders allows hospitals to opt out of the government system, to opt out of the single payer system. I think few would do it in practice, but you could at least do it in theory. This isn't even going to allow that. So we will see, obviously, a lot of legislatures have taken a pause on their legislative sessions because of the coronavirus, same way Congress has. We will see how that plays out in Colorado, but that's a potential precursor in terms of what could happen under a Biden administration as soon as next year.
Yeah, it's going to be very interesting. And obviously, Bernie Sanders is now officially out of the way. That happening, in the middle of the night, if you will, earlier this week. But with him out of the way, one final question before we let you go here. Do we still need to be watching for socialized medicine to be rammed down our throats through Congress or other aspects? Or, having Joe Biden win, in theory, winning the Democratic nomination, we'll have to wait till August for that to be official. But with that happening, do you think that this is something that is going to continue, or is this a death knell for this idea?
No, this will absolutely continue, and I believe it's chapter 8 of my book. People can read about it. Of the goal is still single payer. The debate within the Democratic Party was just, do we do it now in one fell swoop, or do we do it slowly over time and sabotage people's health coverage to drive everyone into a government-run plan? You see people like Pete Buttigieg. His plan for the quote public option, he said it's a glide path to single payer. So what he's saying is, I want to get there. I'm going to rig the system so that it gets to single payer eventually.
Mm-hmm.
That's what Kirsten Gillibrand said the same thing. The father of the quote public option said, Jacob Hacker said, it's not a Trojan horse for single payer. It's just right there. And I lay out in my book all of these quotes by individuals about how this is intended to set a glide path for single payer. and I lay through the economic and the policy case for why that would happen. The Lewin Group in 2009 concluded that a government-run plan, similar to the kind of plan that Joe Biden is proposing, could throw 111 million people off of their private health insurance. Well, if that happens, you have de facto single payer anyway. And that's the potential of what we could be facing next year. So no, I think it is single payer under a more politically palatable guise, but I think it's still single payer in a march to socialized medicine.
Yeah, it's absolutely incredible to see, how things are going through Congress. And folks, if you think that Joe Biden is not going to work with the Democrats after this situation to continue to push that socialized medicine down your throat, you're dead wrong. So if you believe in free market solutions, if you believe that the private enterprise of America is the key to getting out of this, you have got to pay attention to things that are beyond coronavirus when it comes to healthcare. On that note, Chris, thank you so much for spending some time with us here this week. We hope to have you on as we get closer to the election and we can actually talk a little more of the public policy prescriptions that both Trump and Biden will prevail on us. But how can people follow your work and where can they find you?
Sure, I'm on Twitter at Chris Jacobs HC. As you mentioned, I write for the Federalist regularly. My book is The Case Against Single Payer. It's available on Amazon or at your local bookstore.
Thank you so much for joining us. But quickly, before we get away from the show, you've got to check out catcoolers.com. They have got the rugged, the tough, the things that you're going to need for keeping beverages and meats cool as we hopefully get the economy going here in the summer. We get outside, we start enjoying the nice weather, and hopefully life gets back to a little bit more of normalcy. Check it out that is catcoolers.com. And quickly before we go here, I wanted to talk about one thing around COVID-19 that I had found online here, and that is the city of Chicago has begun its antiviral testing and looking for antibodies within COVID-19. And what they're seeing at one hospital, I think it's Roseland Hospital here in the city, as they start ramping up this testing, is that 30 to 50% of the people they're testing for COVID-19 already have the antibodies, which is exactly why I have been saying all along, I think this virus has been here for far longer than people ever have imagined, and that is part of why I think this panic is useless. Folks, go check that information out. 30 to 50% of people tested at one hospital here in Chicago are coming back as having the antibodies and thus the resistance to COVID-19. I think that's interesting, and I'm just going to leave you on that note. Don't forget, you can follow me on Twitter, Facebook, Instagram, Parlay, at The Coppins Show. As always, hit up the YouTube page. Hit that subscribe button, notification bell. Don't miss a single Tuesday or Thursday episode. And, of course, coming up next, right here on Mojo 50 Radio, is my brother from another mother, my millennial brother from another mother, Matthew Holloway and the HollowNet program. Until next week, be smart, be safe, and as always, Matthew 5:47.